The coronavirus outbreak has spread across the world like wildfire, claiming the lives of thousands of people. Now it's becoming clear that nursing homes are among one of the worst hit environments. According to a study hosted by London School of Economics, nearly half of all coronavirus deaths in Belgium, France, Italy, Ireland, and the United Kingdom have occurred inside nursing homes. The research suggests the official daily death tally of the coronavirus may not be accurate and that the governments might be underreporting the death toll by leaving out people dying in nursing homes. The British government has already come under fire for underestimating the toll from the virus, as its daily tally only includes hospital deaths. This is underlined by a growing number of reports that suggest care homes in Europe are struggling, as too many people are dying at once and too many staff are taking sick leaves.
Nursing homes are privately owned by businessmen. They're very lightly regulated. The staff is not very well trained, and hygienic standards tend to be poor. So, and also, of course, patients are crowded together. The staff and patients intermingle very closely. And so therefore, they were a perfect environment for this virus to catch on and spread. So that's why we've had an alarming number of deaths in nursing homes. And of course, the age of the population is also ideal for the virus as well, because many people in their 80s and 90s, and therefore highly vulnerable to this disease.
The toll in nursing homes has prompted wide investigations across several nations, including the United States, Italy, Spain, France, and Canada. Experts believe that apart from suspicions of staff malpractice, a lack of fast and appropriate response to the outbreak in nursing homes can be blamed for such a high mortality rate in senior care homes. Six weeks after the first death was reported inside an American nursing home in suburban Seattle, the coronavirus outbreak continues to ravage retirement homes across the country. A nationwide tally by the New York Times has placed the number of people living in or connected to the facilities that have died of the virus at over 7,000 people. This is a fifth of the total fatalities in the United States. Also, the New York Times has estimated that more than 36,500 residents and employees across the nation have contracted the virus. The figure is much higher than what was previously estimated. Overcrowded and understaffed facilities have raised the risk of terrible tragedies. Fearing for their lives, employees at home facilities are stopping going to work. Yet the situation in the retirement homes is not being treated as an emergency.
Well, of course they should provide testing to prevent unnecessary deaths, but there are a lot of problems. One thing is that testing is in short supply. Another thing is that nursing homes in many countries are only lightly regulated. They're owned by businessmen. The government pays little attention to them, and therefore hygienic standards are often very lax. That is certainly the case in the U.S., where there's minimal regulation and standards of care are extremely uneven and tend to be rather bad, actually.
The toll in nursing homes is likely to rise further, while many coronavirus deaths will never be properly reflected. This begs the question, what could have been done differently to protect the people who are known to be hit the worst by the virus?